assuming there's a correlation between device health and patient outcomes, then accordingly, the efficiency of your organization's ecosystem of people, technology, and processes is pivotal in the improvement of those outcomes. Not sure if that's just a bunch of words or not, but fortunately at CDW, we are experts at aligning people, processes, and you guessed it, technology, finding efficiency gains and optimizing your ecosystem. So in fact, your ecosystem is like a symphony with professionals and staff working in concert with clinical devices and the infrastructure to support your patients. But there are many aspects in this orchestra, each playing a powerful role. One wrong note and chaos ensues. CDW's healthcare team is aligned with ServiceNow, where I came from, to support clinical device management built around the powerful ServiceNow platform. So here's the ecosystem in more detail. We're going to go into it in a lot more detail. But what you see here, we have clinical devices in the center, but the ultimate focus is on the patient. This ecosystem is really powerful, but just like an orchestra, any weakness in the ecosystem creates disharmony, placing patients at risk, lowering employee morale, increasing turnover, driving up overtime, fostering mistrust. It can even result in fines and lawsuits. So this balance needs to be maintained at the highest level. So one of the strengths of the ServiceNow platform is the ability to support this orchestration on a single platform while also enabling easy integration into your existing technologies and infrastructure. As we delve into the ecosystem, remember this webinar is about clinical device management, so it makes sense to start there. Clinical devices serve as one of the key pillars within your organization when it comes to delivering the highest level of positive outcomes for your patients. And that begins with recognizing the need for new devices and being able to easily procure and onboard not only devices, but equipment, supplies, consumables, and to manage your clinical device inventory. Are any of your devices under active recall? What protocols are in place for reporting device malfunctions and nonconformances? How often are devices sterilized, inspected, and maintained? How secure are they? And what % of the devices are mobile and get misplaced? Are your staff properly trained on equipment? Do you have clearly defined maintenance plans? Can you ensure the devices are mapped only to authorized networks? These are all the different things that we're going to be discussing. And these are many of the questions, or the questions that many of you are asking. And while we started with devices, the focus is always on patient care. Devices play a major role here, right? First is accurate data, because devices provide precise data that helps healthcare professionals diagnose patients more accurately and develop personalized treatment plans. There's also improved communications. Devices foster that communication between doctors and nurses and staff and improve patient engagement. And then there's the reduction in errors. Devices can help minimize medication errors, trigger alerts and alarms, and prevent errors that are part of the human experience. Overall, while devices play a critical role in enhancing patient care, their effective management and upkeep are essential in ensuring they function optimally and continue to contribute to high-quality healthcare. Which brings us to maintenance plans. They're not just a smart idea, they're paramount to the health of your devices and, as a result, your patients. So what good is being in possession of devices and equipment that you can't trust? How does that impact your organization's risk to patients and risk from regulatory agencies and governing bodies? With ServiceNow, you define which devices, sites, or properties are covered under a maintenance plan, the time frequency or conditions in which work needs to be performed, and then what specific procedures, what inventory, skills, and documentation or tests are required to complete the work and stay within compliance. The end result is equipment that can be easily located and can be trusted to be fully operational when needed. And in addition to improving uptime availability, it helps reduce errors, improve safety, and improve morale. So can you recall a time your organization didn't have or couldn't find the medical equipment required for a procedure? Remember when I said one wrong note from the orchestra and chaos just ensues? This is just a common example of that, because when it comes to patient care, you don't have time to send out that search party to locate the equipment, hope that they can find it and that it's operable. Healthcare organizations need to balance inventory costs while ensuring availability of properly functioning devices. Having those systems in place to manage device inventory, including the different dates, acquisition date, install date, warranty date, expiry date, cycle counts, and inventory maintenance schedules. They're all critical in ensuring your organization has the equipment available and functional when they need it. Later, I'm going to review the procurement process and how it ties into this overall picture and how the equipment is onboarded and maintained throughout its life cycle. Facilities, that's a big word, right? That's a broad term encompassing buildings, structures, landscaping, parking, infrastructure, even roads. It covers equipment that keeps the operations running, your lights, your HVAC, refrigeration, plumbing, and more. What happens when the HVAC goes down or emergency generators fail? Well, these may have a direct impact on the devices that are keeping patients safe. If you've got low or high humidity levels in an operating room, that can have negative impacts on patients, on staff, on equipment. The low humidity can cause body tissue to dry out and scab over during surgery, and it can increase the risk on surgical site infections. It can also increase the risk of electrostatic discharge, which could damage equipment, injure someone, or start a fire. Many devices are part of the hospital's computer network. They may cross organizations, hospitals, labs, clinics, buildings, and care centers. These networks support a variety of medical procedures and inform healthcare professionals. So whether it's the telecommunication links, the PCs, the imaging equipment, audio video diagnostics, or networks that control lab equipment and heart rate monitors, networks are pivotal in centralizing the monitoring and management of devices. It aids in consolidating data from various sources, and it can be leveraged to push out those ever important system updates and upgrades, performing configuration changes and security needs. And no organization is immune to security attacks, right? Data runs the organization, whether it's manually entered, imported, or integrated from device interactions and readings and test equipment. And that data is often about patients, which makes it sensitive, but it can also be about employees. Similarly, it can be about devices, which can be manipulated if not carefully secured, contained, and restricted to access. So consider the devices that capture personal or patient health information. How do we secure those devices? How does your organization ensure operational continuity during a security breach? Implementing security protocols helps control who can access and operate those clinical devices. Proper authentication mechanisms ensure that only qualified personnel can interact with the devices, reducing the risk of misuse or accidental changes. In summary, securing clinical devices is essential for protecting patient data, for ensuring device functionality, maintaining regulatory compliance, and safeguarding overall healthcare operations from various security threats. Insert time to take a sip. There. Next, we have EVS or environmental services. So clinical devices are dependent on environmental services to maintain a safe environment with proper humidity and air quality that's free of dust. The goal is the support of patients and other employees through proper cleaning, disposal, and sterilization of rooms, devices, and the overall environment. Their efforts help to maintain a clean, safe, and efficient healthcare environment, supporting infection control, complying with regulations like OSHA, the FDA, and a National Institute of Health and Center for Disease Control guidelines. And that leads us to regulatory. Regulatory teams ensure that health-related products comply with regulations set by the governing bodies to protect public health by establishing safety and quality standards. That means anyone involved in cleaning or maintaining equipment knows how to properly document device service and clearly understands the procedures to lock down equipment when a serious adverse event or nonconformance occurs. Tracking to support regulatory standards promotes health, reduces risks, improves product quality, etc. Again, we're talking about those governing bodies, the FDA, the Canadian Ministry of Health, CDRH, OSHA is a big one, NIH, CDC, and supporting their standards like HIPAA, PHI, FDA's 21 CFR Part 11 or Part 803 and others. So we consider the procedures and documents as how we've secured all types of equipment after a serious adverse event. We lock down the chart, the equipment, and in addition, organizations may rely on regulatory affairs or quality assurance units to conduct routine internal monitoring visits like mock OSHA audits or mock FDA inspections within your organization. The next is healthcare professionals. The number one organizational threat is clinician burnout and workforce challenges. So how do we continually improve our practices, upskill the workforce, and keep them trained on evolving procedures and regulations, as well as the devices and equipment your organization is continually onboarding? At the same time, we need to reduce the administrative burden on healthcare professionals and staff to streamline their work so they have more time to strictly adhere to their procedures and focus energy on their patients. So while you're busy managing your organization's delicate balancing act across these teams, departments, and their systems, the ecosystem I just talked about, you continue to refresh equipment, embrace and onboard newer devices. Accordingly, CDW and ServiceNow can guide organizations through the device lifecycle with an onboarding playbook. Although we can also help you to analyze your device needs first, but I'm going to start with the procurement process. So we can procure equipment directly, or you can procure equipment directly through CDW's e-procurement tool, or integrate with third-party procurement systems, or even the medical equipment manufacturers' portals and systems. Upon receipt of those devices, equipment, etc., we can begin onboarding the physical device directly into the ServiceNow platform by documenting its receipt, mapping the appropriate asset and RFID tags or barcodes, and relevant dates and codification. In turn, these devices may also become part of the Configuration Management Database, or CMDB, and granted access to secure networks. We update the location, we define those authorized users, both internal employees as well as authorized third-party contractors. Finally, we initiate the appropriate maintenance schedule or maintenance cycles. Next is the install phase, where we ensure the device has the most current firmware, define the backup procedures, calibrate the device if appropriate, and perform system testing to make sure the device is available and properly functioning. We ensure authorized resources are properly trained. Finally, we confirm the entitlements, including warranties and the service contracts, are in place. And now that the device is active and potentially in use, we need to leverage work orders to document that cleaning and that sterilization, those sterilization procedures by EVS, as well as inspections. We may also address issues via break-fix work or the preventive maintenance and those ever important upgrades. This maintenance is meant to reduce device downtime, keep the equipment at peak performance, and promote a long and useful life of the device. In fact, I would submit when you're doing this properly, you are extending the useful life and availability of that device. But at some point, we may determine that a device has reached the end of its useful life, at least at our facility. And we need to follow and document the stages of decommission, including dispositioning steps like an inspection. And what if the device has potentially identifiable data? We may need to scrub that device. We may need to demagnetize the hard drive and even shred it and document each of those processes and steps in an audit-friendly process, the person, date, and timestamp, and the system used or the method used to perform those steps, and then document the disposal certification. This isn't just for data, but sometimes the equipment may contain hazardous materials. And because of that, we also need to document the disposal and the chain of command or of possession of that hazardous material until it leaves our facility. So here we are back again at the overarching ecosystem. Healthcare organizations are seeing huge challenges in operational efficiency. There's employee burnout and financial pressure that's chief among them, but CIOs know that the right technology solutions can help combat these and other challenges. So this ecosystem is really powerful, but the system can break down due to weaknesses or inconsistent practices, which puts patients and employees at risk. I mentioned it could increase overtime or foster mistrust or lower employee morale and impact turnover. And it can result in those fines and lawsuits. Together, CDW and ServiceNow can help you drive efficiency and improve outcomes by streamlining your ecosystem. So that's my section of the slides. I want to thank you for your time. In a few minutes, we're going to take a quick poll on which area or areas you're seeing the most risk, and we'll discuss that. And after that, I'm going to ask Dustin for some thoughts on data handling and support for legacy data. But for now, let's go to that poll. Kim, can you share that? And I'm not seeing it, so Jim, if you're seeing the results, if you can just talk through them for a minute.
Yet. I mean, folks, if you manage to move to the right-hand side of the screen, you'll see the topics and the choices that are there. Just pick one and then submit your answer.
I will tell you so far, inventory is taking the lead here.
Oh.
That's not surprising. Think of all the inventory locations an organization has, not just in one building, but across an entire campus or across all of your locations.
Pretty split otherwise, but overwhelmingly inventory is going to win.
Oh, wow.
I was going to say I love to hear that, but I don't, because that's a big problem. Fortunately, there are a lot of areas in which we can help streamline that for you. But that's a common problem that we do see, and I was expecting that a little bit. I was expecting a little more around maintenance plans as well. Organizations seem to, particularly since COVID, really doubled and tripled and quadrupled down on environmental services. So great. Okay, I'm going to move on from that, unless Jim, if you want to chime in on anything. Otherwise, I'm going to move ahead.
No, I'm fine. I'm fine.
All right. Jim, how are we doing on time?
We are doing very well on time.
Excellent.
Yeah,
Okay.
so we're good.
Rob, let me just pop back in 1 second to let people know that if you have questions, please feel free to leave those in the chat. We will have a section at the end. We will take questions. So if you want to go ahead and get those queued up, I will get them ready for y'all at the end. Thank you.
That would be great. Yes. I'm looking forward to that. Hopefully you are too, Jim, because you're going to need to answer some of them as well. So I've summarized how CDW is approaching clinical devices and clinical device management. So Dustin, if you're out there with many of our clients already using ServiceNow, how does clinical engineering transition from their legacy system over to ServiceNow clinical device management?
Thanks, Rob. So, well, I think if we take a step back first and think about the way most of our health systems approach our EHRs and then the introduction of standalone applications, we see that most systems take an approach that if the EHR module can perform 80% of the functionality, some of you may have bigger numbers than that, but in general, if the EHR module can perform about 80% of the standalone application functionality, then the organization usually has a stance that the EHR module must be used. And in most cases, this is because the value of having all the data in the same system is greater than the 20% of additional functionality gained by having a standalone application. So when we think about it, ServiceNow is very similar in function to an EHR. They are both platforms managing data. Patients, devices, applications, people, you name it, as a data type. But I'm not suggesting that ServiceNow is an EHR. I'm simply suggesting that there's a similar value in having all of the clinical asset data on the same platform as the IT asset data. And why not even throw in facilities or plant ops asset data as well? There's value in having all three of those components reside on the same system, just like there's value in the ambulatory, the acute, the lab, you name it, data sitting within the same EHR.
Yeah, in fact, Dustin, I think that's a really important point, right? I mentioned earlier, what happens if something in the overarching facilities infrastructure goes down? That has a direct impact in many situations on the devices, right? So being able to have a single system, a single tool to manage those processes, that infrastructure, right, is going to make life a lot easier, right?
Well, yeah, to your point, Rob, when you think about just the simple efficiency gained by the organization when they have a total picture of things like agent plant or assets that require service, or dependencies, to your point, of assets that may be clinical devices on IT systems, as I mentioned earlier, or even on facility systems or EVS procedures. You really think about, one example would be now the chief operating officer has a complete view on preventative maintenance that needs to occur in the future year and can budget for that preventative maintenance, whether it be a clinical device or whether it's an IT system or a facilities, plant and equipment kind of system. But I'll say, Rob, the more direct answer to your question is that the transition strategy will depend on timing, compliance, and budget, as all things that exist in healthcare world seem to tie back to. But most customers tend to time the transition to ServiceNow from their existing CMMS with the expiration of their CMMS, the maintenance. And then, so once we know what work needs to, when the work needs to be completed, then we suggest that you get together with your HIM and compliance department to talk to them about, well, how much legacy data in the existing CMMS needs to be retained and in which format. This is where the budget comes in, right? So when we start talking about HIM retention periods or retention policies, some of them require for the life of the clinical device. Some of it consider the data transitory and maintain only the basic information that's required by regulatory entities, regarding when's the last time it had a preventative check in service, when was the last time it was updated, those components. And then with regard to retention policies, data also, the data format also drives cost. So other questions that you need to ask of compliance and HIM and even of IT, which is to say, do I need to have a live record in the new ServiceNow clinical device management environment? That is to say, do I need to keep all of the data, the historical data, readily available in point and click format within ServiceNow, or can I attach a PDF with all the historical data to that device entry within ServiceNow? You can see where attaching the PDF might be a little bit cheaper than trying to backfill all of the data from the prior CMMS. Other things that we need to think about when we talk about the legacy data is, do I want to keep the data in a separate location like a cloud? Do I need the data to be backed up, which we all know creates a secondary copy of the data and a secondary cost to retaining the data? Do we want an additional paper copy of the data? Still, some people do this, but there aren't as many nowadays. Most are choosing an electronic format. But all of those types of decisions and conversations with your HIM department and your IT department and compliance department drive costs and need to be considered when you're developing the transition plan. And I'll finish my answer to Rob's question with a question for all of you to think about. And so when I led the clinical engineering department, a patient's complaint about a broken TV in an acute room would require a clinical engineering tech to check the pillow speaker. It would require an IT tech to check the network port and cable box connected to the TV, and a facilities tech to check the TV and the electrical outlet. So the result here was 3 different incidents or tickets in 3 different ticketing systems for the same service issue on the same piece of equipment. So the question to you for consideration, at least as we move on in our webinar, is how many of you have similar issues in your organization where clinical devices and IT devices or facilities devices intersect? Wherever you have those intersections is a point to look at migrating to a single source system like ServiceNow from disparate systems that belong to clinical engineering or biomed or facilities management. So if you're looking at how do I make the case for this and what are the areas I target, start by looking at those intersections. And so when you do that, ideally the staff is much more productive when they can call in an issue and leverage a single platform, regardless of whether it's facilities or IT or clinical engineering. So now, I'll throw it to Jim with the question, can you name a few of the key advantages of using ServiceNow clinical device management?
Hey, and Jim, before you do that, I want to call an audible and take 1 extra minute. I apologize, but because inventory was like one of the top answers, I also want to take into consideration what we consider inventory within a healthcare organization, right? There are fleets, there are mobile devices that, we talked about equipment that goes missing or gets misplaced. Some cases it even gets stolen, right? Inventory is such a big aspect of that. So being able to properly tag and control and maintain that is so very critical. And I think that there's just so many best practices across a number of industries, but across, in particular, the regulated industries that would benefit the healthcare organizations. So that's all I wanted to say. Yeah, Jim.
Rob, that's great. That's great. I think, as we go through the materials here, I think we have an offering for the audience. So let's cover a few thoughts here as far as what are some of the advantages, if you will, of using ServiceNow's clinical device management in conjunction with what we've presented so far. So thanks, Dustin. I think from a CDW perspective, we see many advantages to the functionality. First is from a workflow. So Dustin gave you a great example, right? Imagine a ServiceNow platform, and then the clinicians and your staff are really submitting, if you will, issues for something that has to get resolved. I was with a hospital last week. This is exactly 2 different systems that they have to navigate. So streamlining those workflows gets to be really important. Risk management. When we talk about that, we talk about compliance and risk management built into the platform. And so it gives you a better view, if you will, across the organization, not just IT, but also with the clinical devices. And it also helps you when it comes to the requirements that are put upon you from JCO, CMS, and the FDA. As far as this next item here, there's a key benefit in optimizing those maintenance schedules to improve the overall way in which you manage these healthcare systems. So this is definitely something that's going to help you maximize the investments you have in your existing devices.
Reducing asset spend.
Oh, reducing asset spend. And that leads us right into this whole idea here of patient care. Because as Rob pointed out, as you manage those devices, you ultimately are going to impact that patient care. Imagine you're the clinician or the nurse and you're in the middle of something and something breaks. That's what we're talking about. And then in addition to that, Rob, you brought up a good point, which is cost reduction, right? So manage your devices to its maximum and therefore will lead you to cost reductions. We know in healthcare, the number 1 expense is around labor. The number 2 expense is all of this clinical device management. And that's a focal area for CDW. And then finally, we want to talk about security. We have talked about it a couple of times here, but it's really important because of the way in which you have a distribution of devices, all requiring different access for how you want to do things. And so with a platform like ServiceNow, you have the ability to manage the devices, but also take a look at exactly how are they being managed and how do you work that into your security framework. So given that, I think we have time for another poll question. So actually, Rob, let's pass this over to you. Is there something that Rob discussed that we're missing in our approach here in this webinar? So in the chat, right? If I got it right, Rob? In the chat, put in if there's anything that you think we're missing, right? Rob covered a number of different topics. I'm not quizzing you on that, but what did you not hear, if that makes sense? And then Kim, if you could sort of give us any kind of feedback that you hear, and then we can address those things.
And I think I'll chime in. One that I don't see called out here specifically, and when we were doing dry runs of this webinar, right? This doesn't just happen, our thoughts, right? We've actually done a few dry runs, right? We questioned whether or not safety belongs here, but safety is really encompassed within all of these, right? There's a safety aspect to each and every one of these. So where we could call out safety specifically, safety belongs in environmental services, in regulatory, in maintenance plans, facilities, etc. So
any other feedback, Kim, because that you may see in the chat?
We got one response. It's an acronym ITAD. Are you familiar with that?
You want to spell out ITAD for me? IT asset distribution or?
Be a good one.
Disposition, IT asset disposition. Yeah, that's actually something I put on one of the previous slides where we talked about the life cycle and the dispositioning process and the regulatory documentation that goes along with it. Not just the disposal of the asset, but maybe we send it off to a third party. Maybe we harvest materials from it. Maybe we sell on the secondary market, but there are a lot of regulations around that as well. Maybe it has PHI on it on the hard drive, so you need to document all of those processes. So,
Great.
Absolutely.
Great. Okay, then. So, for many of you listening to this webinar, live or as a replay, CDW is an elite partner for ServiceNow. And what we wanted to cover today was the ability here to streamline clinical device management through the use of our point of view when it comes to doing this, plus our work with ServiceNow. The other item that we covered here is integrating clinical engineering and IT on a single platform. You heard Dustin talk about that. It may not sound like a lot, right? Because your clinical engineering teams are enamored with whatever solution they have, yet you've made a significant investment in ServiceNow. Leveraging that platform is the real purpose here in terms of doing it, because it leads to these two things that are available there. And as mentioned earlier, patient care is number one. In addition to that, we are looking here at streamlining a lot of these operations, right? You become more productive, if you will, in terms of how you do this. The thing that struck me the most was when Rob went from the playbook of procurement all the way to decommissioning. Some solutions that you may have may cover one or two of those areas, but we want to encompass the entire chain, if you will, of activities, again, on a single platform that will actually help improve productivity, reduce costs, and all those things. I know I'm being redundant. I've already said this a couple of times, right? But it's a key point as you take away from this webinar. So in order to help you, what we would like to do is in the survey, those of you that are hearing the recording, you'll see it in the email. Those of you that are online here, as you get the survey, there's a little checkbox that says, are you interested in talking to us, to be able to come up with a summary, if you will, of findings? Can we take your systems where many of you said, hey, inventory is a key issue for us. We can come in and help you with that, and then match that up against the things that Rob was talking about, the points that Dustin was talking about in terms of how he sees managing clinical engineering, and how Rob's perspective across that entire chain of events from procurement to decommissioning gets to play out. We would come in, we'd love to talk to you, we'd love to create a little findings report and kind of help you manage, if you will, the left and right within your organization. And I realize that for some of you, you're not all the same. You're using different solutions and different systems. But the benefit of CDW is we've seen a lot of that. We're really good at managing a lot of the ServiceNow capability, and we're here to help you.
And Jim, I love this slide that you're sharing right now. One of the things I want to point out, the top bullet, the anonymized survey results. So you may think your problem is X, but as we engage with different people within your organization, right, we'll reach out to them with a specialized survey, and we'll give you the picture that your counterparts, your peers, your subordinates, whatever, what they're seeing and what they're feeling, right? I think that's really important. Of course, we'll look across your organization and compare it with the ecosystems, the best practices in the ecosystem compared to best practices overall, the practices you've employed versus the best practices in which you could improve. So
great. Thanks, Rob. We've been talking a lot. We've shared some commentary. We shared some slides with you. This is your opportunity, if you wish, if you feel like providing in the chat any kind of questions or feedbacks for my other coworkers on this given topic here. As I mentioned before, there's a survey coming out. So if you want us to work with you on a findings report, we're happy to do that. But so at this point, Kim, if there is a question that's out there, kind of let us know, and we'll answer here in the remaining minutes that we have for this webinar.
Yes. So the only other one we have right now is from Chris. It's more of a comment than a question, but I'm sure you can run with it. He says, staff in our big organization find ways to bypass processes to get what they need. Would like to have consistent intake with inventory.
I bet you would.
Yeah.
That's part of that procurement process we said, right? What are the standards your organization implements, whether you're talking about, something as, a tongue depressor or lab equipment or capital equipment? What is that onboarding process? How do we make sure that it's consistent and the data that needs to be captured, because the data that needs to be captured for tongue depressors looks completely different than it does for an actual piece of medical equipment, right?
So Rob, Dustin, is there any experience that you've gone through that kind of matches up with Chris's comment in terms of that sort of thing? Because I have a story, but I wanted to bring you in on this and see if there's anything that you've experienced from your days of running these groups.
So yes, I've felt Chris's pain. I would say that the direct comment I would make, one is, as we all know, it's got to be an organizational-wide process that's followed. Supply chain or contract and supply, whatever it's called in your health system, needs to be and does have access to all of the acquisitions, unless they're small acquisitions made on like a corporate credit card. But it starts with contract and supply, controlling that and putting, whether it's clinical engineering or IT or facilities, whomever it is, in as a valve check at a certain level. Usually there's a dollar threshold we use. And then the other piece Rob mentioned earlier, which is one way to control that flow is by connecting it either to CDW for purchasing, connecting it to your medical manufacturer for purchasing, but connecting that ServiceNow link there so that the second that asset's ordered, it starts to show up in your system, in your ServiceNow system, as a device that has not been delivered or received yet. Then it gives you awareness to say, holy cow, somebody just ordered a bunch of med surge beds that require network connectivity or whatever it might be. I don't know why they're ordering them when we have some in the warehouse already today. The other thing that helps is, and it's also not easy to do, but managing and monitoring utilization of your clinical devices, so that then you can shift that device. So that then at a higher level within the organization, we say, look, no, we don't need to order 15 more portable CT scanners because this hospital in our system requires them. We could shift 2 from the other hospitals that are underutilized or not utilized at all. So a couple different ways to manage the assets that kind of sneak in the back door, if you will. Those are just a couple that I would throw there, but it definitely starts with the organization's adoption to a purchase process and approval.
I think we'd agree. We'd agree. This does happen. So you really need to be prepared for some of these things. Rob, you were going to say?
Yeah. So there's also the inventory definitions of min and max levels and safety stock levels and ABC and XYZ codes for value versus usage and reorder points, things of that nature, which are going to help streamline that. But then there's the badging process, badged procurement, badged receipt, badged disbursement, right? So you might see some vending machines in facilities where, hey, I need a new pair of gloves or something like that. I swipe my badge, right, and I can get that, right? That whole badging process can be expanded in different ways across the organization to help manage that better.
Great. I'm going to see here. I think we're going to come to the end here, and I wanted to put this up here as we close. On behalf of Rob, Dustin, and myself, Kim, and the team here at CDW, we really want to thank you very much for your time and attention. Again, those of you that are here live, great. You'll get that survey. Those of you who are seeing the replay, again, it'll be in an email. So you'll be able to respond back to our findings questions. And the other point that I'll make is look out for future educational sessions. There'll be other industries, other topics. Periodically, we'll be coming out with these webinar sessions. I wanted to thank you very much for your time. And let me turn it over to Kim if there's any any parting words from Dustin or Rob, and then over to Kim.
Yeah, just if there are any topics that you're interested in seeing we'd love for you to dive deeper on maybe one of the areas specifically within this ecosystem we talked about, or something else related to healthcare that we're not talking about.
Okay.
So please, Kim, were there any other questions out there?
Nope. We got it to everything. So thank you guys very much.
Excellent. I'm surprised no one brought up AI or generative AI, right? We see and hear that everywhere.
The whole presentation without talking about it. That's pretty
right,
good.
Exactly. But by the way, there are a number of ways that both ServiceNow and CDW can help you leverage AI and generative AI to think of determining. Dustin, you mentioned that point earlier. What's that break point? Should we be reordering or procuring a new device? Should we be maintaining it, or should we be replacing it? Right? AI can help us determine what that break point is. So I'm not going to open the can of worms. Sorry, Jim. I know we're ready for a closeout, but there's a lot of things we can do with AI.
That's another webinar. But good. Anyway, thank you very much. We ended a little early, so that's good. Want to give you 5 minutes back on your time. Thank you very much. Really do appreciate it on behalf of CDW and the team. Thanks.
Thank you all.